Hi there, my name is Adrienne Griffin, and I'm the Executive Director of Maternal Mental Health Leadership Alliance. Thanks so much for stopping by today to hear about MMHLA and the important work that we're doing to advance policy around maternal mental health. So when I talk about maternal mental health, what I'm discussing is really anxiety and depression during the 2-year time frame from conception to baby's first birthday. What we used to call postpartum depression, we know is so much more. It's not just postpartum, it's also during pregnancy, and it's not just depression. Oftentimes, it's a lot of anxiety. These conditions are the most common complication of pregnancy and childbirth, affecting 1 in 5 birthing people each year. Unfortunately, of those who experience MMH symptoms, only 25% actually get treatment. And this comes with a huge price tag. The annual cost of not treating maternal mental health conditions is $32,000 per parent-infant pair, or $14 billion each year in our country in lost wages and productivity of the mother, and addressing the poor health outcomes of the mother and the child. Women who live in poverty and women of color are even more likely to experience these conditions, but less likely to get help due to lack of access to health care, due to cultural and racial biases in our healthcare system, due to higher rates of adversity, and fear and stigma that concerns that either Child Protective Services or immigration agencies may become involved. As many of us already know, the COVID pandemic has created unprecedented stress and anxiety for childbearing women, opening a Pandora's box of worry. What will happen if they contract COVID-19 while they're pregnant? Will their baby be affected? Will they be able to have a support person with them in the hospital? What if they or their baby test positive while in the hospital? Will they be separated? And each of these questions is answered on a case-by-case basis, on a hospital-by-hospital basis. We're also very concerned about maternal deaths in the postpartum period. We've all heard a lot about maternal mortality. What we know is that self-harm, meaning suicide and overdose, are one of the leading causes of death for women in the first year postpartum. We know that new mothers who die by suicide use the most violent forms of suicide, and they often die in a late postpartum time frame. Most of these deaths actually occur after day 42. We also know that fewer than 50% of these women actually attend a postpartum obstetric visit, but that more than 50% of them will visit an ER or a hospital within 1 month of taking their life. So we know they are reaching out for help, which is really, really important that we have standard screening guidelines so that women and birthing people are screened consistently during the 2-year time frame that includes pregnancy, labor and delivery, and the postpartum time frame. And many, many medical governing bodies, including the American Academy of Pediatrics, the American Academy of Family Physicians, ACOG, the United States Preventive Services Task Force, have all come out with recommendations around screening within the last few years. But we really need to develop a gold standard of screening where everybody agrees to certain time frames. Fortunately, maternal mental health issues are often temporary and treatable, and most parents recover with a combination of self-care, social support, talk therapy, and medication. The last several years have seen a lot of activities at both the state and national level around maternal mental health. First, at the state level, in 2018, the 21st Century Cures Act was passed that provided funding to states to create programs to address maternal mental health conditions. 30 states applied for these grants, and 7 states received funding for 5 years. The FY20 federal budget also requested the Department of Health and Human Services to report on activities in the agencies about maternal mental health. There's a whole series of proposed legislation in the Congress right now. 2 issues that I'm going to focus on are first, hotline funding. There has been $3.5 million allocated for a national maternal mental health hotline. This was passed by the House of Representatives, and we're waiting for the Senate to vote on that. And I'd also like to point out that we're working hard to extend Medicaid. We know that Medicaid covers almost 50% of births in the United States, including 66% of births to Black women. We also know that many of these women are at risk of losing their Medicaid insurance at 60 days postpartum. leaving them uninsured at a medically vulnerable time in their life. It's really, really important that we get Medicaid extended so that women are covered for that full year postpartum. We're also working hard to make sure that women who are pregnant or breastfeeding are included in COVID-19 research. Folks have worked really hard to create a national curriculum in reproductive psychiatry. It has distinct learning modules across women's health across the lifespan, a whole section on pregnancy and postpartum, and then a discrete section of 5-hour essentials that could be used in any learning environment, in medical school, in conferences. So this is really a great, great resource. Folks have also been working hard on performance measures, making sure that performance measures around screening for perinatal mood and anxiety disorders, for postpartum depression and anxiety, are included in Medicaid and in the HEDIS set of performance measures. There's also been a great deal of activity at the state level. You can see on the top right that there's been many states that have already extended Medicaid. There have been several states that have created task forces and commissions that help set a roadmap to address maternal mental health issues. Several states have started psychiatry access programs, which increase the capacity of frontline providers to treat these illnesses, and it also gives them access to psychiatry consultation. A handful of states have had public awareness campaigns. Several states have passed legislation about education, whether these laws require educating providers or mothers about maternal mental health issues. And a few states have actually passed laws requiring screening for these issues. So just a word or two about the Maternal Mental Health Leadership Alliance. We are a national nonprofit. Our sole mission is to focus on federal policy around maternal mental health issues. And our ultimate goal is that all childbearing women will be educated about and screened for anxiety and depression and have access to resources for recovery. Again, thanks so much for stopping by. You can reach me at agriffin@mmhla.org, and my phone number is 571-643-2738, and I would love to hear from you. Thanks again.